Bismillahirrahmanirrahim and Assalamu alaikum. The topic which we are going to discuss today is the anatomy of the lungs. As we have in our body the two pair of lungs, the right lung and the left lung. The right lung consists of two fissures. The one is the horizontal fissure, the other one is the oblique fissure. The horizontal fissure starts at the level of the fourth costal cartilage and it ends at the mid-axillary line by joining with that of the oblique fissure. These two fissures divides the right lung into three lobes, the superior lobe, the middle lobe, and the inferior lobe. As compared to that, the left lung only has one fissure that is called as the oblique fissure, which divides the left lung into two lobes, the superior lobe and the inferior lobe. The depression here which we can see is referred to as the cardiac notch and the extension here is referred to as a lingula. The important point here is the auscultation of the lungs. The superior lobe is auscultated above the level of the fourth rib. The middle lobe is auscultated between the fourth and the sixth rib, while the lower lobe is auscultated at that of the back. We are going to discuss the segments of the lungs in detail. This picture only shows the interior view of the lungs. The posterior view is not being shown in this picture. Now coming to the right lung, this is the superior lobe, which consists of three segments: the apical segment, anterior segment, and the posterior segment. This is the middle lobe, which consists of medial segment, which is directed towards the mediastinum, and this one is the lateral segment, and the inferior lobe, which we are going to discuss in detail later on. Now coming back to the left lung, this is the superior lobe, which consists of two subdivisions, the upper division and the lower division. The upper division consists of three segments: the apical segment, the posteriorly there present a posterior segment, the anterior segment, and the lower division, which is referred to as a lingular division, consists of two segments, the superior lingular segment and the inferior lingular segment, and this one is the inferior lobe. Inferior lobe of both the lungs consists of five segments. This one is the superior segment, this is the medial basal, this is the anterior basal, this one is the lateral basal, and the one is the posterior basal, which is not being shown here. The most important clinical significance of the segments of the lung is that the segments are separated from each other by the connective tissue, as a result of which they act as a discrete anatomical and functional unit. So whenever there is an infection to the one segment and we want to remove that segment, we can remove it surgically without affecting the function of the other segments or the whole lung. The other point which is very important to remember is that the infection remains confined to that area without affecting the whole lung except in TB and cancer. Now we are going to discuss the impressions which are present on the lungs in detail. The first lung which we are going to discuss is the left lung. This is the apex of the lung, and the dome-shaped surface present inferiorly is referred to as the diaphragmatic surface. This extended border here, which acts as a flap, is referred to as the interior border. The point where the interior border ends is referred to as the groove of the first rib. Just above the groove for the first rib, there present a dip, which is referred to as a groove for the subclavian artery. Always present below the apex, the area which is present is referred to as the area for the trachea and the esophagus. The groove here is arch-shaped groove, which is the groove for the arch of aorta, which descends downward and forms the groove for the descending aorta. Now we are going to discuss these structures in detail, which is referred to as the hilum of the lung. This is the oblique fissure which divides the left lung into the superior and the inferior lobe, and the extension here is referred to as a lingula. Coming back to the hilum of the lungs, through which the structures enter into the lung and leave the lung, we are going to discuss this structure briefly here. First of all, this is the pulmonary artery, this is the bronchus, and these are the pulmonary veins. Now, the extension here of visceral and the parietal rula, which is separated by the connective tissue, is referred to as the pulmonary ligament, and this whole structure combined is referred to as the root of the lung. The depression here is the area of the esophagus, and this big impression here or depression is referred to as the cardiac impression. And this is the cardiac notch. Now we are going to discuss the impression on the right lung. This is the right lung. First of all, we are going to discuss the anterior border. The point where the anterior border ends is referred to as the groove for the first rib. Just below the groove, the area which is present is referred to as the area for the thymus and the mediastinal fatty tissue. As you can all see here, this is a very important landmark. This is the groove for the superior vena cava. As we all know that this is the superior vena cava, which is formed by the junction of the right brachiocephalic vein and the left brachiocephalic vein. As this is the right brachiocephalic vein, so This is the groove for the superior vena cava, and just above the groove for the superior vena cava, there present the groove for the brachiocephalic vein. As you can see here, this is the tributary, which is referred to as the azygous vein, an arch-shaped vein which drains into the superior vena cava. So this arch-shaped structure here had a great impression, which is referred to as the groove for the azygous vein. Now we are going to discuss the groove for the subclavian artery. Just below the apex, we have already discussed the area is confined to the area of the trachea and the area of the esophagus. As this is the right lung, so it has two fissures. This one is the oblique fissure, this one is the horizontal fissure, which divides the right lung into two lobes, the superior lobe, the middle lobe, and this one is the lower lobe. Now we are going to discuss the structures which are present at the center of the right lung, known as the hilum of the lung, in detail referred to as the root of lung. This is the bronchus, pulmonary artery and pulmonary vein, bronchopulmonary lymph nodes. This is the pulmonary ligament. Three impressions are left in the right lung, which are the groove for the esophagus, the groove for the inferior vena cava, and this one is the last one is the cardiac impression. To discuss the root of the lungs in detail. This is the root of the left lung. This is the root of the right lung. The level at which the root of the lung is present is T5, T6, and T7. It connects the medial surface of the lung to that of the mediastinum. The root of the lung is also referred to as the hilum of the lung, and it is the area through which the different structures enters and leave the lung. Now we are going to discuss the order of the different structures which are present in the root of the both lungs in detail. First of all, from anterior to posterior, the structures which are present are always present in both the lungs in the same order. Which means, first of all, we have to understand which is the interior border of the root of the lung. The area where the pleural sleeve is present is referred to as the interior border, and the pleural sleeve is the area where the visceral and the parietal pleura combines with each other. This is the interior border of the left lung, as the pleural sleeve is present here, so this is the interior border of the root of the right lung. So, from anterior to posterior, the structures in both the lungs are the same. First, there is the pulmonary vein, then there is the pulmonary artery, then there is the bronchus. As you can see here, pulmonary vein, artery, and bronchus. The bronchus is further divided into three parts: superior lobar bronchus, left main bronchus, and inferior lobar bronchus. From above downwards, the structure present in both the root of the lungs are different. In the root of the left lung, the structures which are present from above downward are: first, there is the pulmonary artery, then there is the bronchus, superior lobar bronchus, left main bronchus, and inferior lobar bronchus. Then there is the pulmonary vein. While as compared to that, in the right lung, the above structure which is present superiorly is the bronchus, same as that of the left bronchus is this superior lobar bronchus, right main bronchus, and then the inferior lobar bronchus. After that, there present the pulmonary arteries and then the pulmonary veins. The extension here which you are seeing in both the root of the lungs is the pulmonary ligament, which is basically the combination of the visceral and the parietal pleura, which are separated from each other to that of the connective tissue. Now we are going to discuss the relations according to the root of the lung in detail. The relations which are common in both are basically the pharynx nerve and the vagus nerve. Anteriorly in both root of lungs, they present the pharynx nerve, and posteriorly in both root of lung, they present the vagus nerve. But in the root of the left lung, superiorly they present the arch of aorta, while in the right root of lung, superiorly they present the arch of the azygous vein. On the left side, the left root has the descending aorta, while on the left side, the right root has the azygous vein. What we are going to discuss in detail is the bronchopulmonary segment. This is the trachea. Superiorly, it is attached to the larynx. Then it divides into the two primary bronchi, the right bronchi and the left bronchi, at the level of the transpyloric plane, which is referred to as a sternal angle. The right bronchus is different from the left bronchus. As we can see here in this diagram, the right bronchus is shorter, of a 2 cm in length, more wider and less angulated as compared to that of the left lung. As a result of this, any foreign material that enters into the trachea, the chance of that material to enter into the right bronchi is more as compared to that of the left bronchi. This bronchi then enter into the lungs at the level of the hilum, and then they divide into their respective secondary bronchi. The right bronchus divide into the 3 secondary bronchi, while the left bronchus divides into the 2 secondary bronchi. The secondary bronchi are then divided into the tertiary segmental bronchi, which then start dividing into the bronchioles. The bronchioles are the structure which lack that of the cartilage in their wall. So first of all, they divide into the conducting bronchioles. The smallest part of the conducting bronchiole is referred to as a terminal bronchiole. The terminal bronchiole then ends into the respiratory bronchiole. The respiratory bronchiole are characterized by the thin walled outpouching referred to as the alveoli, which are shown here. This is the basic structural unit and functional unit where the exchange of the gas occur in the lungs. The alveoli consists of further two parts: the alveolar duct, which is the extended airway into the alveoli, and the alveolar sac into which it opens. The main reason here is the conducting bronchioles lack the glands and the alveoli, so they are only involved in the transport of the gases, while the respiratory bronchiole, due to the presence of the alveoli, are involved both in the transport of the gases and the exchange of the gases. As these bronchopulmonary segments we have discussed earlier, they are separated from one another by the connective tissue. So they act as the individual segment which is surgically resectable. They are 18 to 20 in numbers and they have their segmental bronchi supply them. The main clinical point here is the postural drainage, but before coming to the postural drainage, first we have to know what is the cranium. Cranium is the area where the trachea divides into its principal bronchi. This part here is referred to as a cranium. For the postural drainage, we command the patient to lie on the left side. This allows the secretions from the right lung to enter into the trachea as a result of the gravity, which then induces this cranium here as the sensitive area, which then causes the cough reflex and the sputum comes out. This whole procedure is referred to as the postural drainage. Now we are coming to the blood supply of the lungs. The first artery which supplies the lung is the bronchial artery. There are the two branches, the right bronchial artery and the left bronchial artery. In this diagram, this is the descending aorta. We can see here the left bronchial artery that arises directly from the descending aorta, while the right bronchial artery arises from the intercostal artery, which is the branch of the descending aorta. The second blood supply of the lung is that of the pulmonary artery and the vein. The artery here is blue in color because it carries the deoxygenated blood, and vein carries the oxygenated blood. Here we can see this is the pulmonary vein and this is the pulmonary artery. The pulmonary vein artery carries the blood from the right ventricle of the heart towards the lungs and supplies the deoxygenated blood, where it divides into the lobar and arteries and the capillaries. The exchange of gases take place and the oxygenated blood carries back from the pulmonary vein into the left atrium, from the left atrium into the left ventricle, and then through the systematic circulation. Now we are going to discuss the nerve supply of the lungs. There are the two nerve supply, sympathetic nerve and parasympathetic nerve. Sympathetic nerve is supplied by the second and the fifth sympathetic ganglion, and they inhibit the smooth muscles and the bronchial tree. That's why whenever the sympathomimetics are mostly prescribed in the asthma, as they relieve the bronchospasm. The parasympathetic nerve is mainly supplied by the vagus nerve. The vagus nerve further has three fibers which supplies them. One is the motor fiber, which supplies to the bronchial muscles and they cause bronchospasm. The other fibers are the secretomotor fibers, as the name suggests, secretory fibers, so they supply the glands of the bronchial tree. The third fibers are the sensory fibers, which are responsible for the stretch reflex and the cough reflex. Thank you so much for watching my video.